Give a talk on neurosarcoidosis. Thank you, Dr. Tavee.
Thanks for having me.
You guys all want to just stand up just for a minute? Dr. Lohr had a great idea. I know exactly how you feel. I have conference here 7:30 in the morning. I sit way in the back and at 5 o'clock at night. So stand up, take a deep breath, stretch. All right. I do have a couple of disclosures, and I see a couple of my patients here. Hello. Sarcoidosis can affect any part of the nervous system, from the brain to the spinal cord to the small nerve fibers in your great toe. It's rare, only about 5 to 15% of cases. Now, I'm not mentioning small fiber until later. That's actually much more common. But when it is affected, it can be the most devastating organ system. It can look like anything. Everyone thought that this was a brain tumor. They biopsied it. It was sarcoidosis. So it's something that we should all keep in our minds when we have something in our brain that's not quite right. But what are some common clinical things that you may experience? The most common thing is a facial neuropathy or Bell's palsy, when one side of your face just suddenly becomes weak. You can't suck out of a straw, you drool, you can't close your eye. The good news is that most times it gets better. Even if nobody does anything for you, it'll get better. Prednisone can make you get better a little faster. The other thing is what's called optic neuritis or painful vision loss. This is different from uveitis. This is pain, it hurts, especially when you try to look around. Things are blurry. Color especially is a problem. Red looks like pink. In rare cases, it can look like beige or even white. Hearing loss, it's usually both ears, and this one's very hard to treat. A lot of our patients have permanent deficits. So when you have this, go to your doctor right away. The second most common thing is meningitis. So not the infectious kind where you're gonna die if you don't get antibiotics, but meningitis in that you have a layer of, the doctor word I use is goo. There's this goo on the outside of your brain. It's not in your brain, it's on the outside, and it can prevent things from working correctly. And so the patients will come in and they'll say, hey, I don't feel right, I'm a little goofy, I'm a little off, and I'm not walking well. That's what we have to look for. You've got to do an MRI to die. If you don't have a heart device, we could do an MRI. A CAT scan won't pick this up. And the danger of this is if the goo becomes too much, it can block all the drainage systems, and then you get water on the brain, your brain expands. And in these patients, they become obtunded, meaning that you can't wake them up, or they're really sleepy. They need a drain. Get them to the emergency room right away. And then the last thing is, because it can be anywhere in your body, anywhere in your brain, you can have any kind of abnormality. So the most common thing that we'll see is something like headache, seizures, thinking issues, problems walking, but you can also have hormonal problems, meaning you have too much thyroid, not enough thyroid, you gain a ton of weight, you lose too much weight, or you drink too much water. So these are some things that we have to think about. If you're numb on one side, numb in both legs, weak in both legs or on one side, this is something very serious. All right, how do we diagnose it? Well, there's a fancy criteria called Sage-Effects criteria, but really, I mean, there's the number one is if we biopsy it, right? You see something in your brain, it's not normal, you biopsy it. I really don't want to do that because that's your brain, right? And anything can happen. The second thing that's more preferable is called probable diagnosis, and this is when we find it somewhere else in your body, in your lymph node, in your skin, in your lung. If I can find it there and the rest of the neurological issues look like sarcoidosis, it's probable, and that's good enough to bring out my big guns for treatment. And then possible, it looks like neurosarcoidosis, but I'm not sure. So you won't get the big bad treatments. You might get steroids, but we're just not sure. But really, probable is what you want. You want to biopsy something else and not the brain, because you don't want to do this. This was a 28-year-old medical student that came to me after he'd been seen at an outside hospital. He first said he had headaches, right? They found the light stuff. This is if I cut your head and your head is a stack of plates, right? So it's one slice like this. So you can see the white is very abnormal. So guess what they did?
They biopsied it. They went into his frontal lobe, took out the right frontal lobe. They didn't get enough tissue. So what do you think they did? They went back in, and just for good measure, they took the left side out as well. So he basically had a frontal lobotomy. When he came to see me, there was a little kid running around in the room. He didn't recognize that child because the child had been born when he was sick. It was his son. But there's a happy ending. We gave him infliximab or Remicade, and now he is taking classes to become a PA. He might go back to medical school, so he's doing great. Other MRI findings, the meninges, again, meningitis or meningeal involvement, that's that goo. You see that white, this is a side picture of somebody's head, right? Looks like someone took a white magic marker and drew around my patient's brainstem. Like, do you see my arrow here? Right? So it's like this, right? And so that's what you look at. That helps distinguish it from multiple sclerosis. People don't know that, but that's one of the things that we see. The other thing is it can get into your spinal cord. It can be in your spinal cord. It can be the goo lining it. So you see the arrows here, right? There's a little bit of white here, a little bit of white here. This was a 30-year-old African-American radiology tech when I was in Cleveland. And she had this, she had difficulty walking, but she was still okay, she was still working. We tried to get her the right medications, infliximab, insurance company denied it. We gave her everything else, cyclophosphamide, steroids, everything, and she got worse and worse, and this is what happened. She had a brainstem stroke, right in the middle of her brain, quadriplegic. Good move. So we wrote these horrendous letters to the insurance company. Look what you did! Look, you made our patient quadriplegic, right? So they gave her the Remicade. She's walking with a walker. So it's not great, but she's happy. So treatment. So this is what we're talking about now. Infliximab is our go-to drug. There are a lot of drugs out there, but if you ask any neurologist who treats neurosarcoidosis, most cases, not everything, I'm not going to give it to Bell's palsy or hearing loss, but I will give it to brain and spinal cord involvement. That's your drug. All right, switching gears just a little bit. Small fiber neuropathy. Dr. Lower was talking about it earlier. Small fiber neuropathy, unlike brain and spinal cord sarcoidosis, very common. 30 to 40% of our patients actually have this. So what is small fiber neuropathy? So you have, to simplify things, you have two nerves in your body. You have large fibers. This is where I am in space. This is strength. It does cause numbness and tingling. Small fibers is burning, numbness, tingling, pain. It feels like you're walking on golf balls or you're walking on sandpaper. My patients tell me it's like having a sunburn every single day. It can be anywhere. It can be in your face, your chest, your back, your feet. Most commonly it's in the feet, but it can be anywhere. It can switch. It goes from here to here to here, from minute to minute. People think you're crazy because everything looks normal, but you're not. It's real. You might be crazy too, but this is real. This is real. The other thing that it affects is your autonomic nervous system. The other word for this is your automatic nervous system. So these are the things that are not under your control, like heartbeat, right? Your gut, you can't control the gut. Sometimes you have diarrhea, sometimes you have constipation, sometimes you're bloating. And you know, the patients, we try to eat healthy, and then I'll eat something that makes me bloat. I'll eat like cauliflower, and my stomach is out to here, and I'm like, oh, I could have just eaten chocolate cake, right? It got the same effect. So these are the things, sweating. I have some patients who sweat too much, who don't sweat enough. And the patients who sweat too much, I had one lady, within 5 minutes of sitting down in my office, I had to go run and get her a towel because she was just covered in sweat. And this is Chicago. It was like today. So these are some things to think about. All right, so we did a study, it was published last year. We looked at 115 patients who had this. What's interesting is that 90% were Caucasian, right? Because we know that African Americans have a higher incidence, but in our study, the small fiber neuropathy, Caucasians were more common, 90%. Women are still more common, and non-length dependent, meaning it's not in your feet. Over half was in the face, in the arms, in the trunk. It can be anywhere. The other thing, it's not 28 to 15, it's 28 in addition to the 115, sorry. The other thing you want to do is you want to look for other causes of neuropathy, because if there's something you can go after, just do it, right? 64% had diabetes. You got to treat the diabetes. I can treat you as much for the sarcoidosis. I'll throw truckloads of medication in you, but if you don't treat the diabetes, it's not going to get better. Same thing, B12 deficiency. It's so easy. If you have a B12 deficiency and we give you injections or pills, you can get better. So make sure your doctor looks for other things. And then how do you make the diagnosis? So as Dr. Lower was saying, an EMG, it's gonna be clean. Nothing, right? An EMG, does anybody know what an EMG is? I know. Anyone else? It's a really fun test. We shock you and we stick needles in you. I don't get any Christmas cards. So the way to diagnose this, that's going to be clean. The way to diagnose this though is to do a skin biopsy. You take, it looks like a little pen and it's really easy. They take a little piece from your ankle, a little piece from your thigh, and they count the nerve fibers underneath the microscope. That's it. So you can see on this side, right, it's 1, 2, 3. On the other side, nothing. That's how we make the diagnosis. All right, the other way we can do it is autonomic testing, and that is the automatic testing. So we look at your sweat, we put powder on you, we make you sweat, it's 30 minutes, it's really fast, it's a little uncomfortable, you feel zip, zip, and that's it. And then we measure how much you sweat. It makes you sweat, so we measure how much you sweat, how long it takes you to sweat, and then that, along with the skin biopsy, can help make the diagnosis. All right, treatment, what do we do? So you want to treat the underlying disease, right? Because all this other stuff, the gabapentin, has anyone heard of gabapentin or Lyrica, right? Those are Band-Aids, right? They don't fix the underlying disease, they just help with the pain. So to treat the underlying disease, we looked at IVIG. This is IV is intravenous, immune globulin is antibodies. 1,000 people donate their blood. They filter out the red blood cells so it looks like water, and then we infuse it. We infuse the antibodies into you over 5 hours. And what happens is your immune system recognizes the medication as foreign, it binds to it, and you pee it out. That's a very simplified explanation. It also has some anti-inflammatory properties, but it does help. And I'm going to show you in another slide, it does help our patients. I would give it to everybody if I could, except for the fact that it's 50 grand. And if you don't have insurance, the insurance will bargain it down. But 50,000, that's a car, right? That's a luxury car. So I just, a really nice luxury car. But the point though is that it's very expensive, and insurance companies, it's getting tougher and tougher to get it approved. New medications, so infliximab, that's another medication we've been using, that can help as well. Adalimumab or Humira, I think it helps a little bit, and we can use combination therapy. If you come to me within 2 weeks, sometimes steroids can be helpful, but otherwise if you've had it for a while, it doesn't help that much. So this is the 115 patients in our study that received IVIG, adalimumab, or Humira, Remicade, or both. And you can see the IVIG group did great, right? 76% got better, and everyone else did about 70% also got better in the other groups. The patients who weren't treated, 78% got worse. So it's important to try something if the insurance company will cover it. There's a new drug, it's still in clinical trials, it's in the phase 2B, it just finished the phase 2B, we're going to start phase 3 soon, hopefully. But this is called sabinatide, or ERA-290. This is a medication that is, have you guys heard of erythropoietin, or EPO? Or have you heard of Lance Armstrong? Who's heard of Lance Armstrong, like, right? And remember he was cheating, he gave himself these red blood cells. This is something like that, okay? It looks like, so you can't be competing in the Tour de France. But what it is it's in a shot, they give it to you under the skin, and it's a red blood cell booster. But it doesn't, this particular compound doesn't increase your red blood cells, but it does have anti-inflammatory properties, and it can help with pain. So we were involved with this study, so my patients did get it, and they did improve, but the problem is the placebo group, they improved too. So we don't know if it was really improved, but the other thing is, when we looked at the skin biopsy and we looked at the corneal nerve fibers, the nerve fibers in your eye, that did improve. So we'll see, that's why we need to do a phase 3 trial. All right, so that's treatment. Here are some Band-Aids. So this is what we can do until we can get treatment out there for all of you. So, okay, gabapentin, I like it. It doesn't cause any major side effects. It can cause goopiness, a little bit of swelling in your legs, just a little bit. But otherwise, it's pretty safe. I give it to little 9-year-olds, and they do fine. It doesn't interact with any of the other medications. And it's safe. Pregabalin, also known as Lyrica. It's okay, it's like gabapentin. It was actually invented here. Did you know that? The guy who invented it, do you know how much he got? $600 million. Yeah, I know. He's married though, for all of you guys who are interested, he's married. But anyway, so pregabalin, I don't really like it that much. It makes you kind of fat and goofy. 40% of my patients gain weight, but some people like it. So if you do well with it, that's fine. Topiramate, also known as Topamax, or as we call it, Dopamax, can also help with neuropathy pain. It helps with headaches, and it helps you lose weight. It's part of a weight loss drug right now. I had one patient who I put her on a special diet. She took this for 6 months. She was 300 pounds. She came back 6 months later. She goes, Dr. Tavee, I lost 100 pounds. I lost you. So it does help a little bit, but it also causes joviness. It causes kidney stones, in rare cases, glaucoma. Well, give or take, right? About 100 pounds. So zonisamide is Topamax Light. It's cheaper at CVS. It's on the $4 Walmart list. It doesn't have all the side effects, but it's not as effective. And then anesthetics, lidocaine patch. You know, have you been in the dentist office and they give you lidocaine? This is, or Novocaine, this is lidocaine. It's put in a sticker, and we put it on your feet. It helps just take away the pain. It's okay. Capsaicin cream is chili pepper cream. It burns like the dickens, but it's okay. And then other things, amitriptyline, Elavil, nortriptyline, Pamelor. These are also things that I use quite often. It causes dry eyes, dry mouth, but it's relatively safe. You have to be careful if you have heart issues. Cymbalta, also known as duloxetine, it's okay. It helps for depression, but otherwise, I'm not as convinced it's great for neuropathy, and you withdraw. You can't come off quickly, so you have to be really careful with Cymbalta. Effexor or venlafaxine, that's okay too. Tramadol is my go-to drug. It's good for pain. It's a narcotic agonist, meaning it's not a narcotic, but it does help, and it takes the edge off the pain, and it is a controlled substance. You have to have a special prescription. People are going to be watching you, but it's not a narcotic. It's a narcotic agonist. And a lot of my patients who have to work throughout the day and they can't take these medications that make them goofy, they like Tramadol. And then other things, anybody granola in here? They like granola? Yeah. So vitamins. So these are a list of vitamins that have been found in cancer, diabetes, HIV-type neuropathies to be somewhat helpful. I mean, it's not great. Acetyl L-carnitine, glutamine in breast cancer patients. It might be neuroprotective right before they undergo chemotherapy. Alpha-lipoic acid. It's okay. This was found to be in Germany to be very helpful IV for diabetic neuropathy, but we don't know about oral medications. So we think maybe 600 milligrams. It does have a weird side effect. I had 2 women pull me out of the room after their husbands, their husband had the neuropathy. They were taking the alpha-lipoic acid, and the women pulled me out there and were like, Doc, you have to stop this drug. And I said, why? And they said, he's killing me. Apparently, it has a Viagra-like effect, especially if you are on testosterone. You laugh, but I bet you someone would be like, well, how did you spell that? And then fixed vapor rub, it's okay. I don't think it helps that much. The fixed vapor rub, I have a 7-year-old man, his girlfriend puts it on his feet, and he said it feels so good. It's cheap, right? $6. Horse liniment cream, Juice Plus. I don't have any stock in this, but 6 months, over a 6-month period, people from all over the country told me that this was great in my office. I was like, well, so some people may like it. It's so popular. You can get Juice Festive at Costco. Curcumin, this is turmeric. It's that yellow powder in Indian cooking. So it's okay. You have to get it from a compounding pharmacy. Some people like it. It's expensive though, so just be careful. And acupuncture, 50% gets some kind of relief. It's okay if you can afford it. And then mind-body therapies. All right. Any questions? Okay.